You're watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. We are going to have a brand new show today. It's an extreme makeover edition of The Wellness Hour. With us, we have a board-certified plastic surgeon, and these photos are going to blow you away. So if you're, by the way, and today's program is all about tummy tucks and liposuction, the combination of the two that really sculpts out that abdomen area. So if you're not happy with the way your stomach looks, my advice, stick around for the latest edition of The Wellness Hour.
The Wellness Hour, an in-depth discussion with today's top physicians and medical leaders. And now, your host, Randy Alvarez.
You're watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Today's topic, what you need to know if you're considering a tummy tuck or liposuction. This combination of procedures now put together gives amazing results. With us, we have board-certified plastic surgeon, Dr. Mo Zakhireh. Dr. Zakhireh, welcome to the program.
Thank you, Randy. It's good to be here. You look wonderful.
Thank you very much. Now, we've had you on the show before. A lot has changed. You just acquired, you're the new owner of CSI, Cosmetic Surgery Institute.
Right.
Tell me about that. For those that don't know about CSI, what do you do there? What kind of patients do you see?
Oh gosh, you know, we're a fully accredited facility, and we have a full array of services. You know, even spa services. We have two very talented estheticians. We offer ultrasound after our liposuctions and tummy tucks to help smoothen out the skin. We have a full array of lasers. We have Paula, who's our laser nurse, very
Paula's
talented,
great. Met
very
Paula.
knowledgeable. I think the key is that lasers are her passion. It's not, you know, just what she does. You know, it's just, it's amazing. The surgeries that we do, we offer oxygen treatments for our facelifts and lasers and things like that. Just helps the patients heal so much faster. For our, you know, tummy tuck or breast work, whatever scars we may have, we offer lasering of the scars and, you know, things like that. So.
Now, you said on my last show, you said, and you're the busiest guy in the desert. There's no doubt about it. You said, and I love this, you said, I don't want to be the busiest, I want to be the best. You mean that?
By all means. I think, you know, what I don't want to happen, Randy, is that I don't want to be the McDonald's, well, I shouldn't say that, you know, but I don't want to be the fast food service of, you know, of plastic surgery. I want it to be a very personal experience for my patients, and I think I have always wanted to be the best at this because it's my passion.
All right.
Now, you know, if I turn out to be the busiest because I'm the best at it, that's wonderful, but it's never my first goal to be the busiest guy in town.
Now that you're the new owner, I mean, you're going to keep the same staff over there at CSI.
Oh God, yeah. You know, I think, you know, I think 40% of what I do is me, 60%, you know, as far as patients and things like that, it's the staff. We have a wonderful staff. My hat is off to them.
They've all been there for years.
They have all been there for years.
I know they like you, by the way, because I talked to them about you.
Oh, thanks. Yeah, it's, you know, it's mutual, and that's the key. I think, you know, when the staff has been there for years, you realize it's a stable group, it's a stable office. Honestly, it's like a family.
They're friendly, by the way, because it's intimidating walking into some of these offices. Right. Everybody looks so great, and but they make you feel welcome, which is nice.
It's very warm and personable.
Little Miss Becky, Little Miss Becky's still there?
Yeah, you bet.
She talks to your patients.
She's our patient care coordinator. She's wonderful. She's just a, you know, spitfire, very energetic, you know, very nice. Yeah. All
right, now, liposuction. Now, Dr. Ball is retiring. We're going to have you both on the show as well, but he's retiring.
Right.
And I guess as the, you know, as the beginning of the year, so you're going to be the new lipo king, but you've been doing lipo for quite some time. I mean, you're not new to liposuction.
Yes, well, you know, I started doing liposuction when I was at the University of Utah, but, you know, at a university setting, because of, you know, budget reasons and things like that, there's a lot of instruments that you don't have access to, which, you know, here at the Cosmetic Surgery Institute, we really have the latest and greatest instruments and technology available to us, and the key is that we're always striving to make ourselves better by going to meetings and things like that and looking at people's work with a very critical eye. And so, you know, I think that's why when I came here, you know, my whole liposuction technique changed because I could let it evolve and develop.
What was it like, by the way, to train under the king of lipo? And it sounds so corny, but he really was and is the king. I mean, probably did more lipo than anybody in the world.
Right. Right, and you know, the things that he does, you know, and the standards that we have now within our Cosmetic Surgery Institute are really revolutionary. You know, for example, you know, the liposuction cannulas, or the rods that we use, we make little stab incisions and we pass the rods under the skin to suck out the fat. The majority of people, the rods that they're using are this thick. Okay. And so, you know, and
the instruments that are sucking the fat.
Right. So this, you know, rod this thick is getting pushed under the skin back and forth thousands of times. So it causes thousands of tunnels this big.
Tunnels.
You know, to suck out the fat.
Explain that, tunnels. What do you mean?
Well, as you pass this thing under the skin, it has pores on the surface of it, and it sucks the fat.
Okay.
So that tunnel of where the fat used to be now is an empty tunnel.
Okay.
So, you know, as you can imagine, I mean, this is a pretty big rod. The instruments that we use here are the size of the tip of this pen.
Okay.
Okay. Very, very small. And so imagine 1,000 tunnels or thousands of tunnels this big or thousands of tunnels this big under your skin.
Yeah.
Well,
does it give you a better result?
Much better result, because what happens then is that the skin, I see a lot of you know, old liposuctions that are done, and the skin gets kind of ripply.
Yeah.
You know, or they get like big indentations here and there. But when you use the smaller rods, you get a very nice and smooth result.
Now, with liposuction, is this
Yes.
a new concept where you combine the tummy tuck and liposuction, doing them both together? Anticipating this interview, some guys say, hey, that's maybe too much at one sitting.
Right.
What do you say to that?
You know, that's a very good question. I like to say it this way. I know through my skill level and my technical expertise, I know where to be aggressive and where to be conservative, and that's the key. You know, knowing. So, for example, you know, when I do liposuction, I liposculpt the patient's back, their bra line, which is very bothersome, and their lower back area, their love handles.
Yeah.
Okay, and I come around the corner, you know, and I really sculpt their waistline, and then I do the tummy tuck. Okay. Now, you know, I don't do the liposuction of the front with the tummy tuck, because, in my opinion, you got the blood vessels coming around the corner here, and when you do liposuction here, you knock out a lot of those blood vessels, and so down here where the incision is, you're at risk of causing infection and wound breakdown and things like that. So what I like to do is I just do the tummy tuck, and then if need be, I come back and I do the liposuction of the abdomen, you know, maybe a month later after everything's healed up. Most of the time, I notice that this flap of skin, it's kind of like a rubber band. You know, when it's sitting there, it's thick, but when you pull on it, it gets kind of thin. So most of the time, it gets 50% thinner anyways. And so, you know, 50% of the time, you don't need to come back and do a liposuction. But, you know, the patients are absolutely happy with it, you know, because of, you know, when you tell them because of safety reasons, who can argue with that?
What are the age ranges of these patients coming in for liposuction and tummy tuck?
Well, that's a good question. You know, I mean, I have a wide range of patients. I have the 18, 19-year-olds that work out a lot, and they just have become disenchanted, disappointed, you know, and maybe it's genetic. You know, they get a little bit of kind of saddlebag or a little bit of a pooch, and despite working out hard, running, exercising, they just can't
Is
get
that
rid
your
of it.
favorite kind of patient? I mean, that must be easy for you.
Well, sure. Those
And
are
a great result for them.
Those are the patients that liposuction was made for, but again, I mean, you really have to pay attention to detail, because you don't want to get ripples or lumpy, bumpy, you know, areas on a 19-year-old's abdomen. You know, they want to put on a bikini and, you know, be able to show off their results without people knowing they've had liposuction, you know. So, and then I get the young moms, you know, 29, 30, who have had 2 or 3 kids. Their abdominal muscles have become stretched out. They want to come in for tummy tuck and a little bit of, you know, liposuction on the flanks or love handles. And I've started combining my tummy tucks with breast augmentations, and I call them, you know, the kind of the mommy makeovers. And that's working out great, because I mean, they look amazing. I brought some pictures, you know, I'll show you, and they just look amazing.
Mommy
and
makeover.
It's truly incredible how their self-confidence changes. They look in the mirror, they love what they see, so their self-confidence changes, their relationship with their husband changes. It's really amazing how that, you know, metamorphosis occurs. And then, you know, I have the 50, 60-year-old patients, you know, that have gone through menopause. And, you know, when you go through menopause, you kind of get thick through here. You know, when the ladies start looking matronly, you know, they come in, they specifically say, I feel like I look matronly, I don't want to look matronly. we liposuction their torso, or maybe they've had a tummy tuck in the past, and they wish to have that tummy tuck revised. And one of my biggest pet peeves with that population.
Okay, we're going to heir your pet peeve now.
Yeah. Oh, you
get fired up. Okay.
One of my pet peeves with that population is that they've had a tummy tuck in the past, and their surgeon wasn't really artistic. Maybe, I don't know, but they get that vertical incision. That vertical incision, down here below the belly button, tends to be a little bit higher, and then it goes against the body's anatomical lines, and that vertical incision actually makes the patient look boxy.
Well, what else do you do?
That vertical incision adds to their mid-torso looking heavy and matronly. What you have to do is you have to be careful where you place your incisions, and you have to place anatomical incisions. So what I do is I place my incision, the middle portion of the incision is very low in the pubic area, and then I curve it up, kind of like a French cut bikini.
Are you that much better than you were 5 years ago at doing a tummy tuck or lipo?
Yes, because the thought process doesn't stop. So I'm always trying to make things a little bit better. That's why, I started doing liposuction of the back, because I noticed that when I was doing tummy tuck only, the patients would get that muffin top because their fat and soft tissues were extra here. So I realized that if I sculpt that for them, sculpt their waistline, they don't get that muffin top, they look that much more feminine, it looks beautiful.
Do you think you have an advantage, by the way, being a plastic surgeon that does tummy tucks? Because I learned recently that not everybody really likes to do tummy tucks unless they're a board certified plastic surgeon for certain liability reasons. Is that why? Because it seems like only the plastic guys do tummy tucks.
Well, what happens is that the plastics guys do tummy tucks. We're more adept at doing tummy tucks because we've done general surgery.
I see.
We've been inside the abdomen. We know the anatomy of the muscles. We know what's underneath the muscles. That's very important. We know how much we can tighten the muscles. And then we know the blood supply to the skin, so that when we pull down the skin, we know exactly how much tension we can put on the skin without killing that skin flap, So
I guess my question is, though, that if somebody's going in for liposuction, it seems to me that for your best consult, and I say this when people are in LA or wherever, they should be going to a person that does both the tummy tuck and liposuction. Because if you go to a guy at a consult and he doesn't do the tummy tuck, then he is going to be more inclined to just do liposuction.
Oh, yes, sure, of course. Yeah. You have a hammer, everything else in the world is a nail. You bet. Yeah, you bet. If you go
So is that your recommendation too? I mean, do you feel that way? Obviously you're biased, but...
Well, if you go to a guy that only does liposuction, he's going to, turn you towards liposuction. But if you go to a guy that does tummy tuck and liposuction, then you have more options for your patients. That's very important.
Okay, we're going to take a quick break. These photos, we've got to show these photos. These are the best photos we've ever had on the show.
Thank you.
As far as being dramatic.
Sure.
So you're watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. We are here with board-certified plastic surgeon, Dr. Mo Zakhireh. He is the new owner. Just took over CSI, Cosmetic Surgery Institute. Dr. Ball is retiring, is that right? And all the same people are going to be there.
Yes.
And we're talking about tummy tuck and lipo, this combination of procedures. We'll be right back. You're watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Today's topic, what you need to know if you're considering a tummy tuck or liposuction. We're here with board-certified plastic surgeon, Dr. Mo Zakhireh. Okay, some of these photos.
Sure.
Tell us what we're going to see first, by the way.
Well, the first picture is really going to pack a punch. I mean, it's a very dramatic picture. But I want you to realize, Randy, I'm going to skip back and forth a little bit.
Between lipo and tummy tuck.
Between lipo and tummy tuck. Because, a lot of times patients come to me, they don't even know what they're a candidate for. Or somebody comes to me, they ask for tummy tuck where they're a candidate for lipo, vice versa. Somebody comes and asks for lipo where they really need tummy tuck. So this first picture that I want to show you is a very dramatic picture.
I've never seen anything like that before.
Yeah, well, that's because you don't necessarily see these people out on the beach or walking around too much, because they really become shut-ins, and it's kind of sad. This patient, when
that's a big overhang. I mean, that's huge. Is that common? I mean, do you see these people a lot, or do they don't even go in because they think
once every couple of months? We get people like this that come in. They're depressed. They actually, that pannus is very heavy. They have a lot of back aches and pains. And this lady in particular, when she saw me, she was like, I'm so depressed, I can't even look in the mirror. Okay? So now this is not trick photography, Randy. Okay. But at least I gotta also tell you, this is not, this is a very dramatic result. It's not, kind of your typical average. And I swear to you, this is not trick photography. This is this patient, the same person 6 weeks later. Okay?
That is amazing.
Pretty amazing. So what I ended up doing for her is I went in and I liposuctioned her full back.
So these aren't touched up, by the way?
No.
Okay.
No, and everybody, that's a very fair question. I swear to you, it's not touched up. I sculpted her back, her waistline, all the way up to her bra line, and I did her tummy tuck. I lifted up this pannus. The one thing that I do, Randy, which I think is another helpful thing, is I really am aggressive as far as tightening my patient's abdominal muscles, the fascia, okay? Like for her, I tightened her about, 6 inches, which is 12 centimeters, okay? That's a lot. If you think about it, tightening an internal corset, that also brings in the waistline. It just helps suck it in, okay?
What does that patient say, by the way? How does their life change after getting something like this?
It's very funny you should ask. We slowly watched her morph into somebody else. She walked in, she was walking more upright, she had the most beautiful smile, and she was the kindest person, and she'd cook us, brownies and cakes and stuff and bring it in for us. Her makeup changed, her clothes changed, and down the line, 3 months later, she came to me one day. She was very sad because she said that she had to say goodbye, but she was very happy because we had changed her life so dramatically. She had been in an abusive relationship. Her husband had been abusive. She told the guy to take a hike, and she met somebody else, and she was moving to Florida. So I thought that was so neat. Yeah, I thought it was, and good for her. I mean, I really had a lot of respect for her. Now, this patient that came in, she's a mom, and again, she had 3 kids, and she, when she looked in the mirror, in the top pictures, that's the befores, when she looked in the mirror, she just did not like what she was seeing after having had her kids. And she was like, I want to go back to what I had in the past before the kids. Now, what I want you to notice, Randy, is that she had stretch marks all the way up to her, above her belly button. And, this is how much we could move her skin down. The top portion of the stretch marks is all the way down to her bikini line now.
Yeah.
So her
and that's a small bikini.
Yeah. And also the other thing that I want you to pay attention to here, or the viewers, is that the flank area. Notice how
waist
well
is cut
sculpted this is. Yeah. Notice how small her waist is here now versus here.
It's a sexy look.
Okay.
Is that a young patient?
Yeah, she was, in her early 30s. Very kind, supportive husband, by the way. Her husband was just so supportive. He wasn't the kind of guy that pushed her into this. He was like, she needs to be happy when she looks in the mirror. I love her either way.
Okay.
Now, the key to this, I want to point out to you, Randy, is you notice the patient's torso before and after. After this surgery, the patient's torso is at least 1/3 smaller from front to back.
Yeah.
This is a very important concept that nobody talks about. What happens is that when you tighten the muscles so much, the whole abdominal cavity decreases in volume, so the stomach cannot expand. So, Randy, what happens then is that as the patient eats, they get full faster. So if
is that what they tell you?
Oh yeah. So if they can eat a full bowl of cereal before surgery, immediately after surgery, they only eat 1/3 of a bowl of cereal.
Okay.
But that's the key, though, is that their portions decrease in size. And I tell my patients, don't starve yourself. You got to eat every 2 to 3 hours. When they eat every 2 to 3 hours, their metabolism picks back up, and they actually tone up and they lose weight. That's the key.
When you do things like this, and to a patient, this is a major step. For you, it's routine because you do it all the time. Do you see that they start taking better care of themselves? That means their life changes. This gives them kind of leverage to start eating better, exercising more.
Definitely, and that's why I choose to do it for the majority of my patients, because when they look in the mirror, they see that they've got this beautiful body. They respect it again, and they start walking. It happens automatically. They start walking, they eat better. If they smoked before, they have an aversion to smoking now. They have an aversion to sodas now.
Love it.
It's amazing how it changes them, and it happens ever so subtly. Now, this patient, I want you to notice that in her bikini line, you see her pannus. Pannus is kind of folding over.
The fold of her stomach.
And we were able to take their whole pannus away and gave her that very athletic abdomen.
Yeah.
She's absolutely happy. I mean, just amazing results.
And that's a tummy tuck and lipo?
Well, you know, actually with her, I was able to get this result for her without any liposuction. The previous 2 patients were tummy tuck lipo combination. This is just lipo, okay?
Do you ever have patients that walk in, that's self-diagnosed, and say, I need a tummy tuck, and all they need is lipo? Because I think the impression, if somebody's just tuning in, Dr. Zakhireh only does tummy tuck, or is always thinking tummy tuck on everyone.
Right. Yes, I do have patients that come in and they're absolutely convinced that they need a tummy tuck, and you know, they just need liposuction.
Well, do you think tummy tuck before you think lipo?
No, you know, the way I judge the patients is multiple. You know, number one, I have them kind of tighten their abdominal muscles and then totally relax. Well, if somebody tightens their abdominal muscles and they relax and their tummy doesn't move back and forth, then they don't really need their muscles tightened per se. The other thing is that, you know, whether they have stretch marks or not. You know, if a patient does not have stretch marks, chances are very good that you can do liposuction on them and their abdomen, their skin tightens up, and then they get great results.
What about the younger patient, the athletic patient?
Yes, the younger athletic patients, you know, are very good candidates for liposuction. I get a lot of younger athletic patients that come in and they just have a little bit of saddlebag here, or they have just a little bit of a pooch. But you know, athletic patients, their skin is very tight and they do very well with liposuction. Okay. Now she actually came in and this is one of my sort of what I call mommy makeovers.
All right.
She came in, she had kids, and you know, she felt like she may need a tummy tuck, but she wasn't sure. But you know what? I looked at her, she had great skin quality, and I just thought that she needed liposuction and a breast augmentation. Now, I got to tell you that she had liver surgery when she was a very young girl at the age of 3 or 4. So she was very... she noted that she had the scars and she hated them.
So those upper scars are from another surgery?
Right. So I actually revised her scars for her too. So, but with liposuction, look at her profile picture and notice the abdominal contour without liposuction and with liposuction. Yeah. It's pretty amazing. And then the other thing is that her waistline, I was able to contour only with liposuction to where her waistline is now much more hourglass.
Yeah, that's a hot, athletic look. Right. That looks good right there.
And she has no dimples, no lumpy, bumpy areas. Her skin is very smooth.
Now we have time for a few more photos.
This patient came in and she absolutely hated her saddlebags. She was so heavy, and she just simply wanted to wear, you know, pants that were form-fitting, and she just looked funny in her pants. So, you know, we took away her outside thigh and her inner thigh, and she just
liposucked it off.
And she loves it. Yeah.
No more saddlebags.
Right.
Very nice.
This patient came in and she said, well, you know, I really want a tummy tuck, but I'm afraid of tummy tucks and I've gotten matronly. And so what we did for her is we just went in and liposuctioned her abdomen and took away the front of the abdomen and the sort of liposculpted the back area, and we were able to smoothen her out. Randy, I love this one. This is a school teacher that came in to see me, and she hated her stretch marks around her belly button. So
I did a tummy tuck. Pregnancy?
Yes. Large pregnancy.
Again, I've never seen anything like that before.
I did a tummy tuck on her, got rid of the stretch marks. She looks beautiful. She's absolutely happy.
Yeah, this is nice.
Now, this next patient is, you know, she got really, really excellent results. She had an appendectomy. That's what the scar is next to her belly button, and she hated that scar. She obviously wanted to get rid of that scar, wanted to get rid of stretch marks, so we did a tummy tuck on her. I really love the result that she got because her waistline is very contoured, her belly button looks great. She got just the, you know, excellent results.
So this is a younger patient with stretch marks.
Right.
Got rid of them. Okay.
You bet. And last but not least, I think what I would like to show you, Randy, is, you know, I get a lot of gentlemen that come in. I do the liposuction on them. I really, really contour and sculpt their waistline. And then about a year later, they come back and they're totally flat. The intra-abdominal fat has disappeared. They have much more muscle volume in their chest area. You know, so you got to really pay attention to multiple aspects of a patient's
Now,
health.
other areas of the body. We haven't talked about arms, knees, legs, thighs.
Yes.
You're doing all those areas.
Yes, we do all those areas. I'm doing more and more arms, especially in the desert. We're doing more and more arm liposuction and brachioplasty, where you go and cut out that excess skin because the patient's skin is so flabby. We're also doing a lot of what I call circumferential thighs, where you do the anterior thigh, posterior thigh, medial and lateral thigh. You're basically going all the way around.
We're out of time. I want to thank you for coming on the show. Liposuction, tummy tuck, and you're still doing the consults.
I am still doing the consults.
Because you're a busy guy.
You know what? The thing is that I feel that it's very important to make time to do the consults. That's the first impression that the patient gets. You know, I want them to feel like, you know, I'm available and they can ask any questions. And oh, by the way, the other thing that I want to tell you, which is very, very important, you know, after our liposuction and ultrasound is done, we have access to a beautiful technician who does endermology in the valley. Her name is Johanna. And we are referring our patients for endermology. Her machine is a very nice machine. It's directly
to keep it smooth.
Yes, to keep it smooth, to keep the skin very thick and tight, and it sort of tightens everything up, and it makes everything nice and smooth. Her machine is out of Europe. Not too many people have access to the machine here. We're very fortunate to have her in our community.
Great. Thanks for coming in.
Thank you, Randy.
It's always a pleasure.
It's wonderful to see you.
You've been watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. If you would like to see this program again online, visit our website at wellnesshour.com. For now, I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.